He preferred working with animals over people. Less complicated, he'd say. Dr. Martinez ran the overnight shift at Phoenix Pet Emergency, treating everything from snake bites to car accidents, until the night his human medical training surfaced, to save a police dog and reveal his hidden past as a battlefield surgeon. Welcome to the Human Stories. Before we begin this powerful story of hidden talents, second chances, and the healing that happens in unexpected places, tell us in the comments where you're watching from today. And if you believe stories like this need to be told, hit that subscribe button and help us make sure they are. Phoenix Pet Emergency occupied a single-story building on East Indian School Road in central Phoenix, Arizona. The 24-hour veterinary hospital served the entire metropolitan area when regular veterinary offices were closed, handling everything from routine emergencies to life-threatening trauma cases that arrived at all hours of the night. Dr. Eduardo Martinez preferred the overnight shift. From 10 p.m. to 6 a.m. the hospital was quieter, the cases more straightforward, and most importantly, there were fewer people around asking questions about his past. At 46, he'd been working the night shift at Phoenix Pet Emergency for 4 years, long enough to earn the respect of the veterinary technicians and the trust of pet owners who found themselves at the hospital during their worst moments. The overnight team was small but efficient. Dr. Martinez, 2 veterinary technicians named Lisa Chen and Marcus Thompson, and a receptionist who handled intake and client communication. They worked together with the practiced efficiency of people who'd seen every kind of animal emergency imaginable. On this particular Thursday night in March, the desert air was cool and clear, with temperatures in the comfortable 70s that made Phoenix winters famous. The hospital had treated a cat with a snake bite, a dog that had eaten chocolate, and a parrot with a broken wing. Typical cases that required medical knowledge, but not the kind of advanced trauma surgery that Dr. Martinez had once performed. In very different circumstances. At 2:17 a.m., everything changed. The emergency call came through the hospital's direct line from Phoenix Police Department dispatch. Officer Janet Rodriguez was calling about her K-9 partner, a German shepherd named Rex, who'd been shot during a drug raid in downtown Phoenix. "Doc, we need immediate surgical intervention," Officer Rodriguez said, her voice tight with stress. "Rex took 2 rounds to the chest during a warehouse operation. He's stable but losing blood fast. ETA 4 minutes. Dr. Martinez put the hospital's trauma protocol into immediate action. Lisa, prep surgery suite 2 for emergency trauma. Marcus, get the blood bank ready. We'll need canine whole blood, type DEA 1.1 if we have it. Full surgical kit, chest drainage equipment, and cardiac monitoring." The team moved with practiced precision, but Dr. Martinez felt something stirring in his mind that he'd tried to bury for years. The automatic responses of someone trained to treat traumatic injuries under combat conditions. When the police unit arrived, lights flashing but sirens silent, Officer Rodriguez carried Rex through the hospital's emergency entrance. The German shepherd was conscious but in obvious distress, his breathing shallow and rapid. Dr. Martinez could see the wound patterns immediately. 2 entry points in the chest cavity, likely 9 mm rounds, with internal bleeding that would require immediate surgical intervention. But as Dr. Martinez examined Rex, his trained eye caught details that went beyond veterinary assessment. The bullet trajectories, the pattern of tissue damage, the way the dog's body was compensating for blood loss. These were signatures he recognized from treating human gunshot victims in field hospitals thousands of miles away. "Get him on the table," Dr. Martinez ordered, his voice carrying a new edge of authority that Lisa and Marcus had never heard before. "Lisa, start IV fluids immediately. Marcus, prep for emergency thoracotomy. We're going in now. Asterisk." What happened next? In Surgery Suite 2 was unlike anything the Phoenix Pet emergency staff had witnessed during their years of veterinary practice. Dr. Martinez approached Rex's surgery with techniques that seemed to transcend standard veterinary procedures. His hands moved with a precision and confidence that suggested experience with trauma cases far more complex than typical animal emergencies. "Scalpel," he said, beginning the thoracotomy with an incision that was both bold and surgically perfect. As he opened Rex's chest cavity, the extent of the damage became clear. One bullet had nicked the pulmonary artery, while the second had lodged near the heart, causing internal bleeding that would have been fatal without immediate intervention. Lisa Chen, who'd assisted with hundreds of surgeries during her 5 years as a veterinary technician, watched Dr. Martinez work with growing amazement. His technique was flawless, but more than that, he was performing procedures she'd only read about in advanced veterinary surgery textbooks. "Doctor," she said quietly, "where did you learn to do vascular surgery like that?" Dr. Martinez didn't answer immediately, focused entirely on repairing the damage to Rex's pulmonary artery. His suturing technique was perfect, the kind of precision that came from performing similar procedures under pressure, where mistakes meant death. "Just concentrate on maintaining his vitals," Dr. Martinez replied, deflecting the question while working to extract the second bullet. "Marcus, I need better visualization here. Suction and retract." As the surgery continued, both veterinary technicians noticed details about Dr. Martinez's technique that didn't match his quiet, reserved personality. He worked with the calm efficiency of someone who'd performed trauma surgery in situations far more stressful than a well-equipped veterinary hospital. His movements were economical, his decisions instant, and his surgical skills seemed to exceed what would be expected from someone whose practice was limited to animal medicine. After 47 minutes of surgery, Dr. Martinez successfully repaired both bullet wounds, removed the projectiles, and stabilized Rex's condition. The German Shepherd's vital signs improved steadily as the surgical team monitored his recovery. Officer Rodriguez, who'd been waiting anxiously in the reception area, was finally allowed to see her partner. Rex was unconscious but breathing normally, his chest rising and falling with the steady rhythm of successful recovery. "Doc, I don't know how to thank you," she said, fighting back tears. "Rex has been my partner for 6 years. He saved my life more than once." Dr. Martinez nodded, already cleaning his instruments and preparing to return to the quiet routine of overnight veterinary practice. "He should make a full recovery. Keep him quiet for a few weeks. Follow up with your regular veterinarian for suture removal." But Officer Rodriguez wasn't finished. "Doctor, I've seen a lot of gunshot wounds in my 15 years with Phoenix PD, human and animal. What you just did in there, that wasn't just veterinary medicine. That was trauma surgery at the level of what we see at Banner University Medical Center." Dr. Martinez paused in his cleaning routine. "I'm just glad Rex is going to be okay. Where did you learn to operate like that?" The question hung in the air of the recovery room. Lisa and Marcus, finishing the post-surgical cleanup, were clearly listening for the answer to a question they'd wondered about for years. Dr. Martinez looked at Rex, still unconscious but stable, then at Officer Rodriguez's expectant face. "I used to work on different kinds of patients," he said quietly. Officer Rodriguez wasn't satisfied with Dr. Martinez's evasive answer. As a police officer, She'd developed instincts about when people were withholding important information, and everything about the surgery she'd just witnessed suggested there was much more to the quiet veterinarian's background. "Doctor, with all due respect, what I saw in there was military-level trauma surgery. You operated on wrecks like you'd done battlefield medicine." Dr. Martinez finished cleaning his instruments and sat down heavily in the recovery room chair. For 4 years, he'd successfully avoided conversations about his past. But tonight, with Rex breathing steadily on the recovery table and the success of the surgery undeniable, he realized that his cover had been blown by his own competence. "I was an Army trauma surgeon for 12 years, he said finally. 2 deployments, to Iraq, 1 to Afghanistan. I specialized in combat casualty care, treating battlefield injuries under fire." Lisa Chen stared at him. "You were a human trauma surgeon? Why are you working in veterinary medicine?" Dr. Martinez was quiet for a long moment before answering. "Because animals don't lie about how they got hurt. They don't blame you when treatment doesn't work perfectly. And they don't carry guns into your operating room." The weight of that statement settled over the room. Officer Rodriguez, familiar with the psychological toll that combat experience could take on soldiers, began to understand. "PTSD?" she asked gently. "Among other things. After my 3rd deployment, I couldn't handle the human cases anymore. Too much trauma. Too many young soldiers who reminded me of my own son. I needed to find a way to use my medical training without carrying the weight of human life and death decisions." Marcus Thompson, who'd worked with Dr. Martinez for 2 years, but knew almost nothing about his background, finally understood why the quiet veterinarian was so skilled but seemed to avoid recognition or praise. "So you retrained as a veterinarian?" 2 years of veterinary school to supplement my medical degree. Animals need trauma surgery too, but somehow it doesn't carry the same psychological weight when the patient is a German Shepherd instead of a 19-year-old Marine. Officer Rodriguez looked down at Rex, whose life had been saved by a surgeon running from his own past. "Doc, you just saved my partner's life using skills you learned saving soldiers. That seems like the best possible use of your training." "Maybe, but I prefer the anonymity of veterinary practice. Animals don't write newspaper articles about their surgeons. They don't nominate you for awards. They just get better and go home." Lisa Chen had been thinking throughout this conversation. "Dr. Martinez, is that why you always work the night shift? To avoid attention?" "Partly. And because emergency veterinary medicine feels more like the field hospital work I was trained for. Critical cases, immediate decisions, life or death surgery, just without the mortars and machine gun fire." As Rex began to stir from anesthesia, his tail gave a weak wag when he heard Officer Rodriguez's voice. The surgery had been completely successful. He would make a full recovery and return to duty within a few weeks. "Doctor," Officer Rodriguez said as she prepared to transport Rex to the 24-hour animal ICU for continued monitoring, "Phoenix PD has other K9 units. If they need emergency treatment, would it be okay if I specifically requested you?" Dr. Martinez considered the question. For 4 years he'd tried to remain anonymous, just another overnight veterinarian treating sick animals, but tonight had reminded him that some skills were too valuable to hide, even when using them brought unwanted attention. "Officer, any animal that needs help is welcome here. Police dogs, service animals, family pets. They're all just patients who need care." "That's not an answer to my question." Dr. Martinez smiled. The first genuine smile Lisa and Marcus had seen from him in years of working together. Yes, Officer Rodriguez. If Phoenix PD K9s need emergency surgery, I'd be honored to help. Asterisk word of Rex's successful surgery spread quietly through the Phoenix Police Department's K9 unit. Within months, Phoenix Pet Emergency became the unofficial emergency hospital for police dogs, service animals, and working dogs throughout the metropolitan area. Dr. Martinez continued working the night shift, but his practice expanded to include specialized trauma surgery for animals whose injuries required the kind of advanced techniques he'd learned in military medicine. He never spoke publicly about his military service, but the veterinary community recognized his exceptional surgical skills. Several veterinary schools invited him to teach trauma surgery techniques, which he did on the condition that the focus remain on animal medicine rather than his personal background. Rex made a complete recovery and returned to active duty with Officer Rodriguez. The bullet scars were barely visible beneath his thick coat, and his performance reviews showed no lasting effects from his injuries. Most importantly, Dr. Martinez discovered that healing could take many forms. He couldn't return to treating human trauma cases, but he could use those same skills to save animals whose lives mattered just as much to their human partners. At the Human Stories, we believe that healing happens in unexpected ways and places. Sometimes the best way to deal with trauma is to find a different way to use the skills that trauma taught you. Dr. Eduardo Martinez learned that you can't escape your training, but you can choose how to apply it. And sometimes, saving a police dog's life is just as important as anything you did in a combat zone. Tell us in the comments. Have you ever found an unexpected way to use skills from your past? What did that experience teach you about healing and purpose? And from what city are you watching this story unfold? Subscribe to The Human Stories for more tales about second chances, hidden talents, and the many ways people find to serve others after their lives have been changed by circumstances beyond their control. We quote, "I'll see you in the next story." And remember, that quiet professional taking care of your pets might have skills that saved human lives in places you'll never see.